Vomiting, also known as emesis, is the forceful expulsion of stomach contents through the mouth. It is not a disease but a symptom of an underlying condition. Vomiting in adults can result from a variety of causes, ranging from mild and self-limiting to serious medical conditions requiring prompt attention. Causes of vomiting in adults. 1. Gastrointestinal causes. Gastroenteritis, stomach flu, viral or bacterial infection of the stomach and intestines. Food poisoning, consuming contaminated food or drinks. Peptic ulcers, irritation or ulcers in the stomach lining. Gastroesophageal reflux disease, GERD, acid reflux causing discomfort and nausea. Obstructions conditions like intestinal blockages, hernias, or volvulus. 2. Central nervous system causes. Migraine, often accompanied by nausea and vomiting. Motion sickness, caused by conflicting signals from the inner ear and brain. Vertigo associated with balance issues. Head injuries, concussions or trauma can trigger vomiting. Brain conditions, increased pressure in the brain due to tumors, strokes, or infections, e.g., meningitis. 3. Pregnancy. Morning sickness, common in the first trimester of pregnancy, linked to hormonal changes. Hyperemesis gravidarum, severe and persistent vomiting during pregnancy, requiring medical attention. 4. Metabolic or systemic causes. Infections, such as urinary tract infections or sepsis. Diabetes, high or low blood sugar levels, e.g., diabetic ketoacidosis. Thyroid disorders, overactive thyroid, hyperthyroidism, may cause nausea. Kidney or liver failure can lead to toxin buildup, triggering nausea. 5. Medications or toxins. Side effects of medications, such as antibiotics, chemotherapy, or painkillers. Substance use, alcohol or drug intoxication or withdrawal. Toxins, ingesting poisonous substances. 6. Psychological causes. Stress or anxiety can sometimes trigger nausea or vomiting. Eating disorders. Conditions like bulimia nervosa involve self-induced vomiting. Symptoms associated with vomiting. Nausea, the sensation of wanting to vomit. Abdominal pain or cramping. Sweating or pallor, often occurs before vomiting. Dehydration symptoms, dry mouth, dizziness, fatigue, or reduced urination. Other symptoms depending on the cause, fever, diarrhea, or confusion. When to seek medical attention. Vomiting can usually resolve on its own, but medical attention is needed if vomiting persists for more than 24 to 48 hours. There is blood in the vomit, hematemesis, or it appears like coffee grounds. Severe dehydration symptoms occur, such as extreme thirst, dizziness, or confusion, accompanied by severe abdominal pain, fever, or headache. Vomiting occurs after a head injury or with neurological symptoms like confusion or weakness. Treatment. The treatment for vomiting depends on its underlying cause. General measures include 1. Self-care. Rest. Avoid activities that worsen nausea. Hydration. Sip small amounts of water, clear fluids, or oral rehydration solutions to prevent dehydration. Bland diet. Start with foods like crackers, rice, bananas, or toast once vomiting subsides. 2. Medications. Antiemetics. To reduce nausea and vomiting, e.g., ondansetron, metoclopramide. Rehydration therapy. Oral or intravenous fluids for severe dehydration. Specific treatments for underlying causes, antibiotics for infections, antacids for GERD, or insulin for diabetic ketoacidosis. 3. Hospital care. Severe cases may require hospitalization for monitoring, for fluids, or further diagnostic testing. Preventing vomiting. Eat smaller meals to avoid overloading the stomach. Avoid triggers such as certain foods, strong smells, or motion if prone to motion sickness. Stay hydrated, especially after exercise or in hot weather. Take medications as directed, and consult a doctor if nausea is a side effect. If vomiting occurs frequently or is accompanied by alarming symptoms, consult a healthcare provider to determine the underlying cause and receive appropriate treatment.